and welcome to all of our listeners on the Windspeaker Radio Network and to those people that are joining us live on Facebook. I'll be your host for the next hour and a half. With restrictions easing and the warm weather finally arriving, it's a good time to have a conversation about moving forward with our spring and summer plans in a safe way during the ongoing pandemic. I have a number of guests that are joining the conversation today, but I would like to start off with a land acknowledgement. Before I start, I would like to begin to acknowledge that I am joining today's discussion from the city of Calgary, which is the traditional territories of the Blackfoot Confederacy, which includes the Siksika, Piikani, and Kainai First Nations, the Stoney Nakoda Nations comprising of the Chiniki, Bearspaw, and Wesley First Nations, and the Tsuut'ina Nation. This territory is also home to Métis Nation Region 3. While we meet on a virtual platform today, from coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. And before we begin here, I do know I'd like to ask our guests if they could go on mute. So I think we have Wait that's not on mute there. And if you do have any questions today or comments, if you could leave them on the chat on the CFWE Facebook page, where a conversation is being carried live today. And so today I would like to welcome all of my panelists that are here to join me, and I'm excited about today's discussion. It's been a while since we've had a town hall, several weeks, so I'm glad to get together again. And I'd first like to welcome Dr. Chris Zarin. He is the public health and preventative medicine specialist and family physician. He works as the senior medical officer of health for First Nations and Inuit Health Branch, Indigenous Services Canada for the Alberta region. He is a practicing family physician at Elbow River Healing Lodge in downtown Calgary, and he is involved in the Alberta-wide Indigenous Alternative Relationship Plan that seeks to improve Indigenous communities' access to primary care. He is also the adjunct faculty appointments with the University of Calgary and Alberta. So welcome, Chris.
Thank you. It's great to be here. I am also coming to you from Calgary, from my home in Treaty 7 territory. It's great to be back. It's been about, how long has it been? Has it been 2.5 years of this pandemic? We're still talking about it. And it's been my great pleasure to work with you before and with the radio. So it's a great opportunity. Thank you for having us. And I do work for Indigenous Services Canada, primarily as a what's called a medical officer of health. And so I have had the responsibility to support the on-reserve public health response to COVID-19, which we're still actively, it's still an active issue. So we're still, working with our communities to respond to COVID, and every day. So it's we're still busy in that area. So thanks for having me.
Thank you very much. I want to say, Chris, I'm very honored that you're joining us again, and you look a lot more relaxed. Actually, I think all of our health practitioners look a lot more relaxed as we're going into the summer of 2022. So now joining me are the panelists from Siksika Health Services. I'm very honored to have them here today. They do some wonderful work out in their nation and the surrounding area around Siksika. Today we have Charlene Bruff. She is a nurse practitioner, community paramedic team lead, and nursing advisor for Siksika Health Services. Charlene has been working for Siksika for 7+ years, and I will just ask Charlene to come on and say a quick hello.
Thank you so much, Lowa. It's really nice to be here. And yes, I'm Charlene. I'm a nurse practitioner, and I am happy to be here to have this discussion around how we survived and anticipated the needs of the pandemic. And it was really a really big team effort between lots of partners and the health staff here at Siksika. So thank you so much for having us. Really happy to be here.
Thank you. Thank you so much, Charlene. Also from Siksika Health Services, we have JC Solway. She has worked as part of the Communicable Disease Control Team, providing test results, initial assessments, and follow-up care for our COVID-19 patients on reserve and their contacts. JC, welcome.
Hi, thank you, Lowa, for the introduction. Yeah, I'm excited to be a part of the panel today. Like Dr. Serene had said, we're still talking about COVID, so it's always good to kind of just reconnect and see, you know, what's new for COVID.
Awesome, thank you so much. And lastly, from Siksika Health Services, we have Margaret Gerard. She has been employed with Siksika Health Services for 31 years. Wow, Margaret, I didn't know it was 31 years. First as a diagnostic technician and now as a clinical services team lead and acting co-lead of community health. She has been actively involved in the testing components of the COVID-19 response, as well as a supply chain management, PPE and supplies. So welcome, Margaret.
Thanks, Lowa. I'll just say my last name is Kergard, sorry. I know there probably was a bit of maybe a typo somewhere along the line, but I'm really pleased to be here. It's been an exciting 2.5 years. I had actually planned to retire. In the middle of this, I had given sort of Tyler White, our CEO, a bit of a heads up on that. And then once we got into what I call the ocean, it was too late to get off the boat. So I stayed on during all of this time. So it's been good. My background is I'm a combined laboratory and X-ray technologist, and I have been active in that practice for 31 years. I also have a background in health informatics as well. So moving forward and finding out how to use some of the tools through the pandemic and using our EMRs and everything else, we did use as tools. And so the technology component was really, really important. You know, having people like Dr. Serene and Dr. who were also active parts of all of our testing, and everything was really important as well. And I'm really pleased that I was invited to be here today. Thank you.
Thank you very much. Wow, I feel so safe in this team. I have all kinds of support. And lastly, totally had just come from the airport. Thank you, Dr. Hu, for joining us. I'm so thankful that you made time in your day, in your busy schedule. So today we also have Dr. Cha Hu. Cha is a public health and preventative medicine specialist and family doctor. He is also the CEO of 19 to 0, a non-for-profit aimed at increasing vaccine uptake. So welcome, Dr. Hu, if you would like to say a few words.
Yeah, well, thank you so much for having me. You know, not too long ago, I was also a medical officer of health like Dr. Sorin, but with Alberta Health Services. And sort of since then, I created this not-for-profit that's really aimed at improving vaccine uptake through a host of sort of educational initiatives. I'm based in Calgary, like Chris is. It has been quite the 2.5 years, actually, and really excited to be, sharing thoughts with everybody on the panel today. One thing that I spend a lot of my time doing actually is, advising organizations and people on sort of what to do with reopening. I think, it's a sort of sometimes a strange time for some people, depending on how we're feeling. And so really looking forward to sort of sharing the discussion on that. And thanks again for having me.
For sure, thank you. And I would also like to thank the Windspeaker staff and Indigenous Services Canada helping put today's town hall together. And those of us that are joining this discussion today on Facebook, as well as those that are listening live on our radio stream. At this time, I actually will go back to Dr. Hu, and we will go around, and whoever wants to give their thoughts. When it comes to First Nation, Indigenous people gathering, this has been a very, very hard time for all of the isolation, all of the mental health that has come to the surface with regards to the isolation, as we are the type of people that gather and very communal. And so I will go to Dr. Hu, and whoever wants to answer this after we have our doctor's answer. please feel free. Now that we're getting back together in person with our friends and family, and how do we navigate keeping relationships while respecting others' choices?
Yeah, totally. And I think it has been really, really tough for everybody, especially in a lot of your communities. And I mean, I think there's a lot of things that we had to do that caused a lot of difficulty, right? Especially with things like mental health, but also most other health issues. And I mean, I think that when it comes to this and navigating this time when we may be in different places around, how much we need to socialize, how much we want to, how worried we are about COVID, if one of us is very sick or we have a relative that's very sick. I mean, at the core of it all, I think it's really important to just, be a bit generous in spirit, and be understanding, and that sort of we are all coming from a bit of a different place. By that, I mean, I think it's okay to, and probably ideal actually, to have conversations around, just, where is your risk tolerance at? Like, have you been vaccinated? And accepting sort of the decisions that others make, and also hopefully having others accept the decisions that you yourselves are making. I recently just visited my parents for the first time in half a year because they're very COVID cautious, and I had COVID, so it made it a lot easier for me. Whereas a lot of my friends and work colleagues, I think, have been, less cautious around it. And so it's really that understanding that I think comes from open communication around these things, where sort of where we start. And so actually I'll just pause there and see if others have ideas, but we need to be generous to one another. We have been throughout the pandemic. We need to be as well as we begin to reopen, sort of when people are coming from different places.
For sure, Dr. Sarin.
Yeah, it's a great topic, and there's a few unique aspects and the way that we work with First Nations and Indigenous people where, yeah, there is really important required ceremonial activities, gatherings, cultural approaches. And as Siksika Health Services can tell you, this is our third summer. So the local staff is involved and supports leadership with these very difficult decisions and tries to make it as safe as it can be, right? So it's our third go round of sort of powwow season or rodeo. I think the rodeos didn't really happen as much, but some did. And they're going to happen this year. So we know that those legal restrictions that Dr. Hugh and myself had to work under the kind of the framework of how Alberta approaches gatherings has been lifted. That's the reality, right? So there's no law against gathering. There's not going to be any fines issued, and there may be even more changes coming to how the province requires isolation, for example. And all these changes are putting the responsibility on the individual, and in an Indigenous context, really on the community to decide. So what does the community want to do? How are they going to do it? Is it going to be full out, as big as it was before the pandemic? Well, I hope not. And we're here to work with the community to think about how to do things safely the third time round, right? So we know that the less people that gather indoors, the safer it is. And there's individual responsibility. If you're sick, this is a very infectious strain that we have going around right now, right? So if you're sick, you must stay home. And I think there's still a role for kinds of testing, right? So most of that goes on to the individual. So the individual should look at testing themselves at home, or your children and family. The final thing we're really interested in is trying to work to monitor things like the wastewater that will give us a better local idea. So there's wastewater monitoring through a lot of Alberta, a little bit on reserve, not as much as it is in the towns, but there may be local indicators in certain parts of Alberta where, hey, it's not looking as safe as we, because the testing is not happening as much. So I encourage people to understand what wastewater monitoring is going on in their area or where they're planning to travel to. We know people come from the north to go to powwows in the south and vice versa. People from Saskatchewan cross the border, and Alberta First Nations and Indigenous people, of course, go to Saskatchewan for cultural family gatherings. So yeah, lots of tools to help people think through their risk and their family's risk and their community's risk. I'm really proud to have had the chance to work with nations like Siksika, and of course all nations, as they think through this, right? As they try and advise chief and council if they're the health department, and make an informed decision and work with chief and council, because they know they're entrusted with making some of these very difficult decisions. Thanks, Lowa.
Thank you so much, Dr. Sarin. I'll actually go to JC.
Yeah, no, I think it's definitely going to be a good season for us in the summer and all the gatherings to start doing education as well on how to protect yourself and how to come back and be, gather and support your family members and friends. Because just a little story here too, I had actually done a home visit to an elder the other day, and they had called and seen their family member for the first time in 2 years, her sister. And it was one of those things like, it's very surprising that a lot of people are still thinking in the first stages of this COVID pandemic, like we have to completely isolate ourselves. And it was actually very sad, just thinking, she had not seen her sister in 2 years. And that was a really good home visit for me and her to just kind of talk about risk factors and how to safely see family members. And I think it was something that's eye-opening for myself, because I am the chronic disease management nurse here. So I do see a lot of high-risk immunocompromised people within our reserve. And so I think that was something that, for me, I took away of, okay, this is an important thing that I need to now start listening in on town hall meetings like this and seeing what's going on in the province and seeing how I can help my patients navigate coming out of the pandemic and getting back to, the family values and being a community again. So yeah, I think these things are important, town halls and information like this. So I encourage everybody to listen.
For sure. Thank you so much. And thank you for that perspective from the role that you have out there. I will go to Margaret, and I just want to restate the question again for those that might be tuning in. So now that we're getting back together in person with our friends and family, how do we navigate keeping relationships while respecting others' choices? So I'll go to Margaret and then Charlene.
Thanks, Lowa. And again, I think that, as we've been watching the community here, especially, the community is very cognizant of what's happening. And I think, JC made some really good examples of how people are thinking. People are being very respectful about keeping their distances and ensuring that they're providing safety to others. We've had a powwow here just at Easter time. And, as healthcare providers, we were preparing sort of, what's going to happen 2 weeks later or a week later or whatever, what are we going to see with testing? We didn't see even a blip after Easter and the big powwow that we had here in the community. So to me, that says that the community is really taking responsibility for their own healthcare. Before that point in time, again, there was requests from the community for masks and for hand sanitizer and everything else. So, the people that are putting on the powwows, they're thinking about all of these public health issues as well. And I think that's a real positive. And so again, as we're moving forward, I think that's where we're going to be landing.
Nice. Thank you so much, Margaret. Charlene?
Yeah, I agree. I think that, we've had practice for 2 years educating the community. And I think I agree with Margaret and JC. We've had opportunity to do a lot of empowering and education around how to identify risks, not only for yourself, but your family and maybe those, elders or immunocompromised that live in your home or your circle. And like Margaret said, there's such a great response and I guess adherence, for lack of a better word, to kind of the recommendations that we've been able to, to help with. And people are very respectful of each other's spaces and how other people feel, whether you're, pro-vaccine or not vaccine, and how you can protect one another. And I think there's a responsibility in the community to keep everybody safe. And that has been from the very start, of our work around the pandemic. And I think we've had, again, practice, early on, we met with the elders and our society members here. There was a great need to have the Sundance, and it was an important cultural and healing piece to our COVID response. And so working with that group and the society leaders and the community leaders and chief and council to give them the tools to make sure that it was a safe event. And it was a very busy time for us. The risks were all laid out, and we mitigated every risk that we possibly can. And it was a great success, and it was done safely. And I think there was lots of learning opportunities for the community and us as healthcare providers through those events. So again, we've had practice in these smaller events all through, the last couple of years. So now that we start to see things change a bit, and there's more opportunity for larger gatherings, or there's an expectation around larger gatherings, I feel that we're really prepared for that, and that the community has enough tools. And we see that now because we have less and less calls to our CDC line with questions around isolation and gatherings. And, what we've seen in the past was, around funerals and wakes and family events. How many people can we have? What are the restrictions? What do we do? Can we have masks? And what are your recommendations? And we would guide them all along the way, and support them in that. And now we have very few calls because people have the information. They make their own health choices and their own health decisions, which, ultimately that's our goal, to support and be a resource. And so the community is really to be commended for the work that they take on and the ownership they have for the health of them, themselves, their families, and each other. And again, there is a great respect for other people's space. And if you're comfortable to go to those larger gatherings, please come. You're welcome. Wear your mask or don't wear your mask. I think that's, and I did attend the last powwow. With a little hesitation because there was a lot of people in a small space, but there were a lot of people masked, and there was at every entrance hand washing, and people were again respectful of people's space. So really looking forward to kind of the summer's events and how we can support from a distance, and again seeing seeing people making their own decisions is really rewarding. And it just goes to show that the teams at Siksika Health, when we came together to kind of build some of those supports, we had our I think there was 10 people on our CDC team at one point, with the amount of calls, and then having to increase all of our systems, right? The testing, the drive-through testing, and setting that up. And all of the lab work that Margaret and her team does as far as running all those tests and processing all those tests. And then the follow-up. We've had really good support from the community as well when we were integrating new teams, such as I just think because I lead the community paramedics, I know that team intimately, and it was really integral part of our COVID response, having people be able to deliver primary care or check on people that were COVID positive in the homes, and not having to have people move around a lot. It was a really supportive team effort to have that outreach into the community when it was needed. And now we're just seeing some real positive outcomes from that, where our numbers are really, really low on the nation right now. I think we only have this morning 8 cases. So again, grateful for that. So yeah, thank you.
Thank you. I know you guys do some wonderful work, and it's great to hear you have 8 cases when other places are not. They're definitely higher. There's a couple of points I wanted to make that I'm hearing, and I will also go back to, I remember when Dr. Hinshaw at Christmas time had stated that people need to make a mental health decision on what they're going to do and whether they're going to see their family or not. So I think what has happened is we've gone through a phase where now everybody's making their own decisions in the sense of how are they going to protect themselves. The foundation that Siksika has built is a foundation of informing and a foundation of support and having services there for the members. I think you guys do a very good job of informing, bringing these discussions up and having them. And there's not a sense of avoidance. And I think when it comes to Indigenous health, we are so at risk, and we knew that as soon as this pandemic started. And I do know Siksika Health had one of the highest uptakes in the province. And I really think part of that is having the benefits now, having the great uptake for a vaccine. I want to go to the two doctors there in the sense of what is the current uptake and how is the fourth vaccine, the booster that's coming out, that's the fourth one, how is that being delivered? And also what kind of hesitations do you kind of see that might be coming with that one?
Yeah, that's important information that we do want to share. It's Dr. Serene here, Chris from Indigenous Services Canada. I know Dr. Hughes' advocacy really appreciated and worked to get as many people interested in the vaccine as possible. On reserve, we've got a lot of really strong success stories. If we think about what happened, and this is a year and a half of vaccine availability, over 120,000 doses have been given. So just, massive amount of work. And each one of those is a nurse or sometimes a paramedic, sometimes even a doctor. It's what is it? Maybe the nurses can tell me, is it 10 minutes per person, 15 minutes per, I can't even do the math. So much work being done. And we had early opportunities to work with some of the remote northern communities, even going back to its December of 2021. I got to do the math. No, it's December of 2020. Job will correct me if I'm right. And then we had a full year, and now, so we had really amazing initial opportunities to offer the vaccine. And we continue to as you say, I know that there's this booster opportunity happened back then, and now we have the fourth dose for certain populations. The province still recognizes those unique risks of Indigenous people and has had a lower age eligibility criteria for Indigenous people in the broadest sense in Alberta. Because we, as you said, Lowa, we do have evidence of increased hospitalizations and unfortunately severe outcomes like death for First Nations. So, and we're monitoring that really closely. So what I observe in our specific community data is that variability. So some communities have 90% uptake and some communities are about 50 to 60, but every community has done a massive amount of work and continues to offer the vaccines. We noticed with some of the changes in the vaccine mandate and with some of the changes with the latest Omicron wave, unfortunately, the interest hasn't been as high as I'd hoped for. But that's why we continue to work with partners like Dr. Hugh and of course the communities themselves to tell people it's still available. It's never too late for the individual. There is a very solid benefit, right? Especially for those severe outcomes. So get the dose you're eligible for now, right? You do have to wait for 5 months after your second dose, all these things. So people may want to get it sooner, but we try and stick as close as we can to the schedule. And we really focus on the vulnerable populations. There's really high uptake in the 65 plus on reserve in Alberta. Very pleased about that. And then I guess the final point is the largest populations are younger. So, First Nations, Indigenous people are younger. And in that age group overall, it's a little bit lower because that's the way kids and young adults are. The uptake is not always as high, but people are coming forward all the time to protect themselves, to protect their elder grandparents and parents, and to protect their community. So it's mostly a very positive, good news situation, and we continue to offer it. It's still available. So get out there and get your dose, whatever you're eligible for. Thanks, Lowa.
Thank you. I'll ask Dr. Wu.
Yeah, I mean, I think that just echoing some of the things Chris is saying, the variability that you see across, nations, it mirrors a lot of the variability we see sort of all across society, right? So, we work kind of, from groups as different as, First Nations living in downtown Toronto to, rural Ontarians, to Afghani refugees in Calgary. And I think one of the key determinants of how much uptake there is really is how strong the community response is, right? And so that part cannot be understated in terms of building trust. I mean, everything about vaccine uptake, I think once you have some decent access, is around trust. And I really want to actually applaud a lot of the work that's been done sort of in Alberta, a lot of the nations. It's been quite spectacular. We do see lower uptake amongst younger people across the country. I mean, I get it everywhere. I think it, affects younger people less severely than people that are elderly. We know that. We certainly see lower uptake of the boosters as well across the country. And, I can sort of understand why. We know Omicron is, it is a bit more mild. I mean, it can still cause some pretty bad disease, but it is more mild. And I hope that it's, summer tends to be a good time, right? If ever there was a time to take a mental health break and see all your friends and family when there's lower risks, summer is the time. But as fall approaches, well, let's not think too far ahead, but, we'll come again. And, at that point, I think boosting will be more important. And hopefully by then we'll have some vaccines that are specifically tailored to the Omicron variant, right? We know, I think pretty much everybody knows this vaccine doesn't work quite as well against Omicron as it does against everything before it. It's still really good for hospitalization, but I'm hoping that we can get the booster uptake through sort of this concerted action that you've already been doing with some other vaccines that'll come out that are just very geared towards it. But one thing that Charlene said that I think was really, really good. I mean, I'm obviously a pretty pro-vaccine guy, but I do think that whether or not, you're into vaccines, you're not into vaccines, I do think everybody is trying to make the best decision for themselves. And so long as people are doing that, and I think everybody actually is also making decisions they think is best for those around them, right? And so it's that spirit I think we need, because we've also seen a lot of sort of divisiveness across the world, across the country when it came to things like vaccines, and minimizing that as much as possible as we open is really key, just a happy, harmonious, society. So yes.
Oh, thank you very much. I appreciate those two perspectives, and I thank you for the work that you're doing. I want to take a little bit of a different turn here in the sense of asking, and maybe I'll start with JC. What is it that you're seeing currently on the First Nation that you work on as to what our needs are now? Everyone currently has access to the vaccine. Everyone has current access to some of the facts. I think every family has been affected by COVID. They've either had it and gotten over it. Right now that it's May, what are you seeing that people need today?
I think a lot of people are, I guess, on reserve here. They're a little bit concerned, as well as still going back and gathering with a large amount of people, right? And so they're really concerned of, okay, I need that testing right away after I gather. And there's still some needs of, we need to educate them about, risk of getting COVID. And a lot of people had COVID back in the early months of January to March. And so, like I said, just as the eligibility for the vaccine increases goes down in age, decreases in age, we need to kind of just let them know, you do still have some immunity if you've had COVID. We don't know how long though, right? And we don't know how protected you are if you've had COVID. So it's a good idea that we educate them on the importance of getting the vaccine, especially for the younger kids, because I feel like the kids that are going to go on summer break, they're the ones who are going to seek out gathering, and they're the ones who are wanting to, attend events. And so I think we need to get more education out there about how to safely gather. And they do want a lot of testing, rapid tests. Unfortunately, it's not as, you can't get the testing in Calgary as easy, especially down here too. I don't know if we have any more boxes left. It's hit or miss if we do have the self-testing and the home testing. So I think just more education for families and people of how they can safely gather now that we're hopefully coming out of COVID. Sorry, I don't know if that answered the question, but.
It does. It does. It's very, very informative. The one thing as well I wanted to say a bit earlier is that I've been to several nations, and that would include Alberta, Saskatchewan, and even Manitoba. And even though restrictions may be lifted in it, like even down east, I was at a nation down east, and each nation has their own autonomy and what they want to do. So I know at one nation there was actually still roadblocks, and I had to show my vaccine card, and you have to make sure you're still wearing a mask and you go into the nation. Other nations you still have to wear a mask, and depending on what the meeting is. So I do want to let people know that it's a nation by nation, Indigenous organization by organization. And I think there's also a level of respect that we need to have going forward, on the sense of what is it like, what is the current thing that you're doing, right? And that's the first thing that I have my masks with me, and that's what I ask immediately. I still have my vaccine card, and I will say, even to fly, if I'm needing that to fly, I think I'm needing that to go anywhere. So I think that even though these major restrictions, I think it's good to know that our elders need specific care. It's good to know our youth and those that are chronically ill. So even though we may feel restrictions have been lifted, those things I think we still need to be aware of, and there's still a lot of fear out there, as well as fear gone. So
yeah. Sorry, I just wanted to add to just, you raised a good point of fear. I think the biggest thing we need out here is mental health support for a lot of our First Nations and people in general, just coming out of the quarantine and isolation. It was a really hard 2 years, right? And so just when showing, like, the restrictions are very isolating, and even though it's still specific for First Nations, it can be also stigmatizing of, oh shoot, I still have, they're still at risk. Do they think I have COVID? And then it kind of spirals down. So I think mental health support is something that moving forward, we need to really prioritize within First Nations, because like I said, we are a very social group of people. We do enjoy gatherings. We do enjoy powwows and stuff. We do need that support to say, things are okay. Let's talk about it. Let's make the time and talk about it.
For sure. Thank you, JC. Margaret, I'll go to you as well, in the role that you have. What are the kinds of needs that you're seeing that we need right now?
So the testing component is one of them. And again, we were able to acquire a lot of the rapid antigen tests from the province. And so people are asking for them, consistently. And I think a lot of our positives are actually, that are coming through to the CDC team, are actually coming from the rapid antigen tests. The testing is definitely one of the things, but I think JC makes a really good point about the mental health aspects as we've been moving along here. In the last 2.5 years, we have had so much trauma, and I'm sure with every other community in Alberta, the same thing is that we've had unprecedented amounts of death. We've had unprecedented amount of grief that we haven't been able to sort of work through. The community members, I look at it, even my staff, they have lost so many family members in this last 2.5 years. And again, they come to work, they're brave. But again, underneath, I know some of the, they're basically crying. So that mental health component is really, really, really one of the things that we really have to be looking at next. I think unfortunately, and I don't mean to misalign Chris and ISK and stuff, but the pandemic really showed that First Nations communities have such a lack of resources that, again, we look at the amount of resources that we had available, nursing staff. Siksika Health Services is totally, You know, we have benefited from great leadership here. We have a really strong team. We have a long team here, you know, that's unprecedented for people to work for 31 years in one organization, you know, on a First Nations community. You know, you look at those kinds of things and the leadership that Tyler has made and the relationships that Tyler's made, and chief and council that will listen to, you know, a team like us that have worked through it. You know, I think when we look at it, ISK at the end of the day, I think we have recognized that First Nations communities are very, very, very vulnerable to so much. You know, do we have enough resources for testing? Do we have enough resources for people that are ill? Do we have enough mental health supports? Do we have enough doctors even? You know, again, with Dr. Hu, we were doing a lot of testing outside of the nation here, and a lot of the results were going to Dr. Hu at that time when he was the MOH as well, and to Chris as well, to Dr. Serene. And again, when you think of all of that, you know, we are lucky we have 10 doctors here. No other community has 10 doctors here, but we had a really good system where one of our physicians took the lead of reviewing every single lab test and working with the nurses and the paramedics in what do these people need next. But those resources aren't available to 90% of the communities in Alberta or in Canada for that matter. And so when we look at that, you know, I think that unfortunately the pandemic has really shown that there is a real gap in the needs for healthcare people. So when we look at what the community needs, you know, the community has been well supported here. We could, you know, everybody can always say we need more resources, but you know, we were lucky that we have had a robust healthcare system here compared to a lot of communities.
For sure. That's a really good point, Margaret, in the sense of, you know, I think of 10 doctors. I know your emergency management team out in Siksika, and there's several services that are provided for the members, and there's many nations that do not have, you know, and to hear the weight of what was on your shoulders and what was on everyone's shoulders, feeling that weight in the community that has, you know, it says a lot about, you know, this is definitely a true pandemic in the sense of how we've been dealing with it. Charlene, I want to ask that as well of yourself and the role that you're in. What kind of supports do you think today are needed?
Yeah, I think I have to agree with my colleagues that, you know, now that we're just kind of coming, I say out of it, not out of it, but, you know, we're coming down a little bit and realizing where we are and regrouping. And a lot of that has been, now we're seeing the effects of mental health, and a lot of support has been needed around the area of addictions as well. And we see that with our in-home assessments and requests for the community paramedic service. And you know, I guess there's going to be, I guess, an exacerbation of all of the health needs, you know, across the spectrum. But what we're really seeing right now is the need for mental health and addiction support. And that's been longstanding, but it's even, you know, it's increased now. And so we've had to adapt, you know, throughout the pandemic. The days of, for example, waiting in line, you know, to have our members safely medically detox from, say an addiction in the city is no longer. We had to quickly build a system here that was able to support them when they were either isolating at home or didn't have a means to get to the city. So we had to adapt our services and move those services into the home. And we've really had lots of learning opportunities, because in situations like this, it's easy to identify, like Margaret mentioned, the gaps in the services. Oh my gosh, we don't have this and we don't have that. How are we going to mitigate that risk? How are we going to, you know, provide that service or fill that health care need? So, you know, we're fortunate to be able to, like Margaret said, have the robust team to be able to work together and see where those gaps were, identify them early in the pandemic, and then, develop our teams further, add to our teams to be able to provide those services. And again, we were really fortunate to have Dr. Sal Samanani join our public health team and give us direction. And we really had the advantage of looking ahead. And, with his experience, he would say, team, this is what we're going to anticipate. This is what we need to prepare for. And we really felt that we had a little bit of a heads up on where things might turn, and then drawing in the supports from Dr. Serene and the other MOHs and our partners to be able to say, how are we going to work together to fill this gap? And so again, right now, what we're seeing, Loa, is the continued needs for mental health supports, and we can't stress that enough. People have been just kind of bracing down through the last 2 years, getting through, and now we're saying, okay, now what's in front of us? People who we thought maybe were coping well aren't coping well, and so being able to supply those mental health resources is really, really important right now.
For sure. Dr. Samarine, when I think about the services that are needed for First Nations, is there a way that you can talk about some things you see that might also be coming to with regards to services to First Nations and that's being talked about?
Yeah, I mean, it's a rich conversation, and it's important. There's complex realities. There's never enough to go around, and there's different sizes of communities. As you know, there's reserves, there's Métis communities, there's Indigenous people that are isolated in Calgary and Edmonton and Lethbridge and the Grand Prairie and Fort McMurray and on and on and on. And so I think, what is a pandemic? It's a health event that exceeds your resources. So by definition, we are going to be overwhelmed. I think what we try to do is respectfully work with First Nations, who of course work very closely with the federal government. Treaty is very important in Alberta. We respect that, we honor that. We are the funder. We do our best to support what the communities want to do. But the reality is, in a health crisis, we have to have an integrated system with Alberta. So we have to work with Dr. Hugh when he's the medical officer of health. The people go to hospital. We've had 1,000 hospitalizations of First Nations in a hospital. And as you know, those are all not on reserve. So people go to get hospitalized. These are on reserve individuals who've been hospitalized in the towns, and it does not include the urban First Nations who have been hospitalized at another 1,000 people. So we have this massive scale. So we, to give Alberta Health Services credit, they were willing to work with First Nations, but they don't fund and support individuals like what Charlene is talking about. So we have that responsibility as Indigenous Services Canada, and we have increased the opportunity and given communities more flexibility with how they respond to mental health crises. For example, Alberta is likely, unfortunately, the most impacted on reserve for the opioid crisis and fentanyl crisis. We've had 180 deaths during 2.5 years of COVID-19. I don't know how many we've had due to fentanyl, but it would be at least double that, and then double that again, because it's probably 200 or 300 per year. It's colossal. It's a colossal impact. It is a pandemic. It exceeds resources. And so we're working because we're federal, every province is different, right? So the opioid crisis, it exists everywhere in the world, but the greatest impact on reserve is likely in Alberta. Other nations have major impacts though too, as you know, Lowa. And so we've had to say that what works in the East Coast of Canada for mental health and addiction supports may be different. And so we've had to look at some medical options, harm reduction options, and giving the communities the flexibility to pursue that at the same time as culture, language, education is so important at building resiliency, right? And I'm part of that Indigenous Services Canada family that funds all those programs, economic development, and there's never enough. So the list is long, And I hope that our partners in the communities feel supported by your doctors that are with you, trying to say that we need a recovery that focuses on housing and jobs and education and culture as the foundation. So it's a lot of you have my support, and it's good words. It has to be backed with action, of course, and we have to. The final thing I would say is just for people like Siksika and all the communities out there, we have to take a little break. We have to catch our breath. We have to take care of ourselves and do things that we've been waiting to do, whether it's take a holiday, have a controlled family gathering that's safe and effective, because we all need a break. We all need to take that time for ourselves and our families. If you're a healthcare worker, especially, if you work in emergency management, if you're a leader in a community, we have to take that break. We have to catch our breath, and then we have to prioritize what we're going to do for this summer, because we have the list is long. The list is long, and I gave you my top one, which was fentanyl, opioids, and mental health. But each community has to think that through, right? So what are we going to try and do as we're recovering? And recovery can be very long. It can be a year, 2 years, until we're back to where we were. Thanks so much.
For sure. The other thing that, and thank you, it gave a very good wide scope in my mind. The other thing I do know in talking with some Alberta Health Services workers is the lineup of different other health crises that have happened. Like there's lineup for testing, there's lineup for surgeries, so we're being affected by that, I know as well. So I'll go to Dr. Hugh, and again, I'll say it's with regards to the services that you're seeing, or what services do you think are coming that may assist and help?
Oh, coming, that's a good question. I mean, maybe echoing what Chris said a little bit, I mean, this pandemic really had some very bad direct effects, but also a whole host of indirect impacts on every sort of health indicator, mental health being probably the most significant, but everything from surgical wait times to routine vaccinations to cancer screening. In many ways, Alberta was the province that was also the most affected at a provincial level. I think I do a lot of work in Ontario, and I remember when our ICUs were at 300% capacity, and then Ontario was at 100% capacity, and they were sort of complaining, as you probably should complain if your ICUs are at 100% capacity. But here we were, it was quite insane. I think that what is beginning to happen now is planning around the care deficit, which is a term that you may have seen sort of floated around by, AHS or the medical associations. Realistically, when it comes, I'll tell you what's happened. The Ministry of Health has hired an assistant deputy minister to focus on the surgical backlog, which has become quite large. Other than the surgical backlog, which I think was really exacerbated by a fourth Delta wave, where we had sort of the worst hospitalizations and ICU rates, we're really only beginning to plan around some of these issues, right? And so I say I guess I help Alberta Health Services. I don't work for them anymore technically, but we collectively, right? And so I back to sort of what needs to be, we do some good things actually for us, right? If you look at routine vaccine uptake across, Alberta writ large, everyone's gone down. We've gone on less than Ontario. I'm competing with Ontario in my head a lot. When it comes to cancer screening, we've done better than other provinces in terms of how far things have gone down. But any sort of recovery, will certainly require resourcing from the government. And I want to see this soon. The feds recently announced some money for the surgical backlogs, actually a few $1 billion, but that's spread across the whole country. So I don't know if that's really enough. For many of these sort of things, as was with the sort of vaccine uptake effort, it does require sort of like a community-based approach, really, to educate, to inform, to make aware. And this isn't to say putting more on the community, it's just the way things get done, right? So of course you need the people doing the surgeries, and you need the nurses giving the vaccines, and whatever you want to say. But if people don't want to get vaccines, it becomes a lot, it's just more challenging. And so I'm hopeful that during the summer that people have a little break, and they'll be a bit more energized, and we'll get seriously planning about some of these things, because catching up with this stuff it's not going to take a year or two. It'll take years, right? It's not like everything was perfect before. But I mean, I do think a thing that COVID did show is that, you know, by working together, like really actually working together, we can do some pretty wonderful things.
I wanted to thank you so much. That gives me definitely some hope. You know, that things, you know, it's I think we're all trying to say we're coming out of this or we're out of it at the same time. But I want to go back to the vaccine, if I can go to the two doctors here that we have, and then I want to ask in Siksika how the third and fourth dose is actually being taken, and is there still hesitancy? With regards to the third and fourth dose, can you guys quickly go through some of the side effects we might be seeing with those, and how is it for children, and how safe is the vaccine for those that are pondering getting the third and fourth dose? So I'll go to Dr. Summer.
Yeah, go Chris.
Oh, for sure. Yeah, I in my role, I do have to, and I take it very seriously, monitor the vaccine. Part of the international wide post-marketing surveillance. So we contribute. So if you have an adverse event on reserve, it comes up through me and I have to make that determination. You know, we're really fortunate when we look at the billions of these new vaccines that have been given, that we haven't seen a lot of major side effects. So on reserve, we monitor all the adverse events, and with our 120,000 or actually more doses, we've had 44 that we reported up through Alberta Health that met the criteria. It doesn't mean they're serious. It means they're under surveillance. So we contribute to that monitoring. So they are specific conditions that are likely vaccine associated, and we know that vaccines have side effects, but for these ones, fortunately, they're mild, you know, and they're not that much different than the other ones, the ones you expect with routine childhood vaccines, and kids do well with vaccines, right? If you look at kids, they do quite well. Only 3 of those 44 have been in children under the age of 18. And sometimes we're actually monitoring for conditions that may not be a vaccine side effect, but we still report it so that Alberta Health knows, and it contributes to that national system to, you know, to make sure with really rare events, we want to cast a broad net, right? And I might be wrong. It might not be a vaccine side effect, but I report on it. I make sure it's followed up on. And, you know, we do see allergies, no greater rates than other vaccines. So very, very rarely. It's really, when we look back on the year and a half experience with the vaccine, you know, it didn't have to be this way. We could have had a way more dangerous vaccine than we have, right? So we're really comfortable and confident that we have the safe and effective vaccine, and lots of opportunities as we will have to look forward to. You know, eventually we are going to be able to offer it to younger children, right? And then as we move out for the third dose eligibility, you know, 5 months after that second dose that many children got, even on reserve back in, I think it was the end of 2021, we were finishing up most of that. So there's still boosters that are needed, the third dose for those who are eligible now, the 12 plus after 5 months. So it's going to be a challenge because we want to see great uptake, but we know that, you know, in the summer, not many communities do a lot of vaccines. So we look to the fall and we may have to have some pushes there. So I'm really happy to report that very low incidence of COVID-19 vaccine side effects, and that we haven't had a major severe outcome here on reserve in Alberta. I know Dr. Hugh is really a champion too, so thank you for the opportunity.
Yes, before I go, do you know the numbers of, first of all, you had said 120,000, is that the whole year and a half?
Yeah, it's yeah, probably I'll go into those if you're interested. I mean, don't quote me exactly, but about half of those are first dose. So you can see, you know, for the second dose, it goes down by a significant amount. So we're very pleased that, you know, over 60,000 on reserve individuals have had at least one dose. So, and that includes, so that's probably 80 or 90% of all First Nations living on reserve that are eligible, the five plus, right? So really great that people come for the first dose. There's a significant fall off with the second dose, but it's really more marked with the third dose, the booster. And part of that is some people aren't yet eligible, as I mentioned, right? Because it's 5 months after your second dose that you get the third dose. But for each layer, and it's a natural, it's human nature, I suppose, and it's the community nursing staff that is doing all this work, trying to say, well, we know who we gave the first dose to. We're calling them, we're trying to get them in, but you know, it's a personal decision that people make. And then for the booster dose, the fall off is quite significant for the third dose. What's very positive though is the older and the medically vulnerable. Of course, they have a higher uptake of the third dose, and some of them are eligible for a fourth dose. So but there is a fall off, and it's a lot of work. It's on the ground work trying to make sure, hey, you're eligible for that third dose now. Why don't you come in? So get it when you're eligible.
For sure. I'll go to Dr. Hu. And what I want to add as well is, can you talk about, with regards to the third and fourth dose, why should we still get it, right? What are the reasonings around it? And maybe even add to a little bit about what Dr. Sarin said as well.
Yeah. So, I mean, the reason to really get the third or the fourth dose is because the protection against the vaccine falls over time, right? It fell slower for Delta and other variants, but for Omicron, if you don't have a third dose recently, you know, the protection against certainly infection itself is very low. You still have some protection against severe outcomes, but getting that third dose kind of puts you back up into that sort of 90% protection against hospitalization range. Whereas if you don't have it, it's kind of like 40%. And, you know, I think sometimes people would interpret that as like, oh, the vaccines don't work, and they don't work as well against Omicron as the other, you know, variants. But I mean, you know, we think of vaccines like this one as a 2-dose series. But a lot of the stuff we give kids, you know, like tetanus or polio, you know, you have 3, 4, 5 doses. And we think about it that way. You know, that's not quite scientifically accurate, but you sometimes need more than just 2 doses to complete the immunization series. You know, I think, again, right now we're in a pretty good spot. Lots of people have had COVID, immunity rates are high, but certainly as we head into the fall, with the winter that comes in, we're always a little more concerned about COVID and other respiratory viruses. And that's actually when, you know, as I mentioned before, hopefully get Omicron boosters, which would be really things that make it resistant to vaccines. And we're also likely to, fingers crossed, get our first set of vaccines for those under 5 years of age. You know, Moderna recently put in their application for approval to Health Canada a few weeks ago. And that way, hopefully everybody from 6 months to cradle to the grave will be able to get the vaccine. You know, I think about all the things that people want to do, right? And I want people to do everything they want to do, right? I think everybody does. And there is no better enabler. I mean, of course, masking, hand washing, those things are useful, but the one great enabler is vaccination. And so I think that, you know, and this is really the key thing, to be protected, to return to activity in many ways. You know, when you see a drop off from, you know, pretty high for the second dose, lower to the third dose, I don't think that reflects people being into not trusting vaccine so much as it, you know, like I'm the doctor in 3 years, I haven't made the time for it, which is bad. But I think that, you know, making that time for that third is really, really important. On the whole vaccine recommendation front and the safety piece, I mean, Alberta's safety system, and Alberta has not done everything very well, so I'm not an Alberta shill, but our safety monitoring system is very good. Compared to the other provinces, actually, and it was before COVID, and it remains so after COVID. You know, Chris mentions 120,000 doses given. You know, I say more than 1 billion doses of these vaccines have been given around the world, and you know, I think that, you know, that it has been proven to be extremely safe and extremely effective after not 100,000, after not the 80, 90 million given in Canada, but 1 billion doses all over the world and all sorts of different people. And so safety isn't a concern. And the last thing I'll mention is jobs. Is I'm part of this group called the National Advisory Committee on Immunization, which is the big federal group that makes recommendations. And there are some really strong Indigenous physician voices on that. Sarah Funnell, Anishinaabe, a friend of mine, and she's always like scrutinizing the data, advocating, and a big reason why we have the lower age allowability for vaccines under people like her. And so know that there's representation not just sort of at the nation's level, but also right up to the top. We're making the big vaccine recommendations. So I think it's a pretty good thing.
Thank you. Your internet connection was cutting out a little bit, but thank you very much for sharing that. No, that's totally okay. I wanted to welcome Tyler White. He is the CEO of Siksika Health Services. I saw you enter the room, Tyler. Did you want to say anything? And Oki, and it's I'm very honored to have you on. Is he there? Oh, maybe he walked away. I will go to JC and JC, Margaret, and Charlene. What the question that I wanted to ask you is, are you seeing more hesitancy with the third and fourth vaccine, and what actually is working? So hesitancy, and then what is working, and I'll go to JC.
Hi, Lowa. I'm actually just going to ask if Charlene or Margaret can answer this question. I'm having my computer just shut off, so
Okay.
I'm trying to get back on my computer, so I will see you in a little bit.
Okay, thank you, JC. We'll see you in a second here. Charlene?
Sure, I can speak to that. Thank you. I think we're seeing a little bit of hesitancy mostly around the fourth dose. That's where most of the questions on the call-ins have come, around, well, if I had COVID, do I really need the fourth dose because my immunity is such that I may not need it? And so just educating around the length of the time where we think you have some coverage and some immunity, as opposed to when the time goes by to receiving that fourth dose. And they're anticipating, community call-ins are mostly anticipating, when is the age timeline going to be lowered? When am I going to be eligible? And so I think people are thinking about it and talking about it. We noticed, we had a really big uptake in our vaccine clinics. We actually had an opportunity to also provide vaccine to surrounding communities, so just not Siksika Nation members, but we had a really robust vaccine team and was really well supported with supply and resources, and so thankful that we were able to offer it again to surrounding communities. The hesitancy really now is around whether they actually need it or not. And I think there's some, again, confidence growing in the community where they feel maybe that they are able to have enough tools and means to protect themselves, that do they really need it, right? So we'll further the discussion and the education and allow people to make those educated decisions, whether they continue to get fourth dose or fifth dose or wherever may be planned down the line. We were talking to this morning just amongst our teams about COVID fatigue, and people are just, there's a level of people, I think, just really not caring. People are tired and they don't want to talk about vaccine anymore. They don't want to talk about COVID. And there's some, I think, willing to maybe take a little bit of risk, right? And so if I wear my mask and I hand sanitize and I limit the amount of people that I'm around and I stay home if I have symptoms, then do I really need those additional doses? So again, it's just having discussion and supporting, the community as the questions come in.
For sure. Thank you so much, Charlene. I'll go to Margaret. And again, the question is around, are you seeing hesitancy in the third and fourth dose of the vaccine, and what is working?
So I'm going to completely defer to my RN colleagues on this because they're the ones that are doing that work. I'm more into the lab and to testing and some of the other things. But again, I think that Charlene makes some really good points about, people do want to be vaccinated. people have been wanting to be vaccinated. The good part is that we had some really strong leadership from our elders to start off with. And I think, you know, having the elders and society members on board really made a big difference in our community on the uptake. And I think that having champions and trust in our healthcare system, we've talked about this has been part of our panel here, is, you know, that trust, you know, when the people trust their healthcare providers, I think that's made a big difference as well. So, you know, the hesitancy, I believe there is some fatigue as well. But again, I think that at the end of the day, people are really closely monitoring, and some of the successes that we're seeing is, like I said, just the powwow just in April, and the amount of, there was not a huge uptake of positivity rates after that. So, you know, the vaccines seem to be working. The public health measures are working. So I think those are all positives.
Thank you, Margaret. I know Charlene wants to add to that.
Yeah, I guess I just wanted to say, you know, I think access to vaccine is really important, and really taking the time to listen to what community needs and community wants. And so we have a no appointment necessary, walk in on these couple of days availability. And I think that's helping. We've seen in the last 5 weeks, we've you know, vaccinated over 100 people in varying doses, even a few first doses there in some younger ages. So we're thankful for that opportunity, and also having the availability of healthcare providers to be able to transport people in, or maybe administer in different locations, you know, at our elders lodge. So bringing vaccine to them where we can, you know, has been helpful too.
Thank you. JC, I see you're back. Would you like to answer that question as well? And again, the question is, what vaccine hesitancy are you seeing in the 3rd and 4th doses, and what is working to get people to vaccinate?
Yeah, just echoing what Charlene and Margaret said, you know, a lot of people are fatigued about talking about COVID in general, right? And, you know, they got the 3rd dose and booster doses, but, you know, there's always that questioning, you know, why do I need the other doses, right? And so I think for our healthcare team here, we're a very open, you know, team, that if somebody does have a question and one of the nurses or RNs are walking by, they take the time to talk to that person and answer their questions. And a lot of people, you know, sometimes come in just to ask, you know, am I eligible? Who is the eligibility criteria? And we also have to, you know, give kudos to our communication team, you know, where they're very active on Facebook. They're very active in the community, you know, and I am so grateful for them that they're, you know, keeping this a priority and at the forefront, you know, letting the public know in our community that we're still doing vaccines, you know, just a little woohoo, we're still here. So it's good. And, you know, the hesitancy, if we have questions, we are very supported by the ISK team as well. And we really appreciate everything that they've done for us as well. Any questions that, you know, we're uncertain of, we can always refer to Dr. Serene and the ISK and FNIB team as well about questions for our patients who are maybe higher risk or immunocompromised. And, you know, so that's kind of how we're combating the hesitancy here.
JC, thank you so much. I wanted to ask you, who is coming in very willingly, and have they said why they're making the move to take the vaccine now that it's May 2022?
Yeah, I think a lot of the community members that I'm seeing is people who live with their elderly parents. A lot of them are, you know, still taking those precautions and still wanting to protect their parents, you know. And it's one of those things, I get a phone call randomly, just, I'm going to BC. What's the risk of me going to BC? Can I get my vaccine? You know, and it's like, no, that's something that maybe I'm not thinking of, or I'm going to Calgary. What should I do? You know, it's like little things that we take for granted every day, they're thinking of for their elderly patients or parents and their family members. So, and as well, people who are going back to school, parents, they're also asking about different vaccines too, talking to our other community health nurses. They're, you know, Hep B, DTaP, things like that. There's more of a, okay, this is important. My health is now important. I want to keep I want to keep protected and healthy from not just COVID, but everything, right? So that's kind of who I've been seeing coming and asking the questions.
Thank you. I want to go to Dr. Sareen, and I want to ask who is currently eligible today. So what age groups and what access do they have, and how do they go about getting the vaccine?
Yeah, great question. There's some complexities with determining eligibility criteria. And what we do on reserve is we reflect exactly the Alberta Health policy, which you can see on the website. And so every couple of weeks it changes, right? But anybody from 5 up can get their 2 doses, of course. So 5 years is the cutoff. There's no age above which you will not get a benefit. And then that 3rd dose eligibility is uniform 12 plus, I believe, for the 3rd dose, right? But you have to be 5 months after that 2nd dose. That's just the way it works. And then you get into all these little wrinkles, right? And so at times during the pandemic, we've said, well, if I've had COVID, do I wait, as the nurses are talking about here? And there is some evidence, well, it's reasonable to wait. It is good. And we talk about 3 months, and it's a reasonable time frame. And it gets to the point where it's like, it's advice. I'm advising you that most people in Canada, the standard practice, and Ja can speak about the discussions at the national bodies, is that, well, we should wait 3 months to optimize that 3rd dose, right? And so many people have had COVID in January, February, and March that it's common to do that and then get that 3rd dose then, and that 4th dose for those specific criteria. If I'll have to jog my memory, but I think it's 70 plus for non-First Nations are eligible for a 4th dose. Maybe Ja can confirm if he's looking it up. And it's 5 years less for I believe it's for Indigenous people, but sometimes we even get confused with First Nations versus Indigenous, and the communications can be a little bit awkward even for Alberta Health to say, who's eligible? So what I tell people is check the eligibility criteria, phone the nurse in the community, look it up on Alberta Health. We'll work it out for you, right? So it's get the dose you're eligible for. We're all going to be almost all of us are eligible for that 3rd dose right away, and many of us increasingly are eligible for the 4th dose.
For sure. Thank you very much for that. That is very helpful. Dr. Hu, did you want to add to that?
Yeah, nothing. Chris was right. 70 plus for all Albertans, 65 plus. If you're Indigenous, you can get that 4th dose. You have to wait the intervals. Yeah, that was spot on, Chris. You know your stuff.
Thank you very much. I want to say that I was talking with my father yesterday, who is on the blood tribe, and today he's going for his 4th dose. And I felt at ease. He has not had COVID. My mother has not had COVID. And that made me think I need to call my mother to get her, thinking about it. And that also makes me think, I think we all need to do check-ins with our family members. We need to give them the information. I will say, look on the internet at the same time. A lot of our people do not have access to the internet still. A lot of our people are still living in isolation and in fear. As well as just checking in with people. There's so many family members, like JC, when you said someone's sister did not see each other, I think there's a few aunties and uncles I've not seen for 2 years, that I will be calling. You have your little group that you've been connecting with, and I think it's time to connect with those people outside of that, and to check in with those that are also still don't have the services that we do, or even the access that we do. But going into the summer powwow season, gathering celebrations, ceremonies, those things, on one hand, there's an excitement, and on the other hand, there's fear with that. What kind of assurance do you think we could give people, and also just even in their choices? So I'm not sure who wants to necessarily take that. I'll look for hands. on our virtual meeting here who wants to take that. Okay, Dr. Sarin, go ahead, and then I'll go to JC.
Yeah, it's a great question. We are in a context. It's not just Alberta; it's Canada wide, where it becomes individual and family decisions, right? So your own risk tolerance, and so I think it's important to be aware, right? To look at where you live, what's happening, and your personal risk factors for severe disease. We all want you to live your life. We want you to experience gatherings. We want you to be safe. So these small things that we can do to protect the vulnerable are really, really important, right? So if you're young and healthy, get your vaccine, and you can be quite comfortable living your life. It's not going to be 100%, but you're going to be protected against severe disease, and you'll have a lower risk of transmitting it to your vulnerable contacts, right? So you're doing your duty in society right now. But if you're older and medically vulnerable, if you're immunocompromised, you really have to think through how you're going to be safe. And it's going to be a balance. You want to see your grandkids, you want to go visit your neighbors, and so just do it safely and think about masking, think about those individual approaches, and you may be eligible for a 5th dose soon. So that's going to be it. So stay tuned and stay informed. Thanks.
For sure. Thank you very much. The other thing I wanted to say that I was going to say is that the reason why I initially was getting the vaccines, and thank goodness I do have all 3 doses, and my son does as well, and he's 19, and we initially were getting them because we were visiting elders, because we were going to be visiting nations. It wasn't necessarily that I may have felt at risk, even though I definitely did. I think there's a respect that you need to have, especially going on to a First Nation, as to the safety of the people that you're going to visit. So, JC?
No, yeah, I completely agree with Dr. Serene and yourself, Lowa. You just have to assess everybody's personal risk and, just what they're comfortable with. These are really important things for us as a First Nations community to, prioritize sweats, powwows, pipe ceremonies, things like that. Just check in with your family. There are ways to do it safely, and it's such an important thing for us to experience, especially, our people who might not be eligible for the vaccine or even more at risk. We want to make sure that it's done safely for them. Like you said, Lowa, the elders and vulnerables who are very sick. They gain a lot of strength, and a lot of our health and wellness and spirituality comes from these ceremonies and from these gatherings. So I feel that, just as a family, checking in with everybody is the safest thing to do.
For sure. Thank you. At this time, I'll say again, I want to say welcome to Tyler White, the CEO of Siksika Health Services. Tyler, it's an honor to have you and your staff, and I'm always singing the praises of the Siksika Health Services and the great work that you do. And I will give you a few minutes here to say some words and share with those that are listening today.
Thank you, Lowa. And I finally made it. I'm on the Lowa Beebe show. Wow, it doesn't get any better than this. I mean, I can, this is it for me. So I can retire after today, and I've done it all, so just wonderful for allowing, our team to join you today, and want to acknowledge our friends and colleagues. And I guess for me, it's been, a real honor to be in this position, and it's been a privilege to serve our people this way during these, very uncertain times. But for me, what what I reflect on are the amazing work of our team. It's Nurses Week. Of course, we want to recognize our nurses and all our valuable health staff. But these guys are heroes, plain and simple. They are the backbone of the healthcare system, and it's been a long, hard ride for 2 years, and we're not over. We're in a different phase of the pandemic, but at the same time, the teams have done exceptionally well, educating the community, at great sacrifice, to their own selves, so I really just have to give all the praise and thank you to them. I'm the biggest cheerleader for them. I try to, serve different roles and different capacities, but I'm just in awe of what the team has been able to do in, of course, collaboration with our partners from the federal and provincial government. And yes, we've lost people during COVID, but I always reflect on, well, how many people have we saved? Because of the excellent work, because of the proactiveness, because of the compassionate care of our teams, we have saved lives, and so I will reflect on this, with great humility, but also just with a big thank you to the team and everyone here. And I think, Lowa, like with platforms that you have, I think bringing, folks on, like our esteemed colleagues here, I think it's a wonderful message to share. I'm a little zoomed out. I don't know about you. I'm hoping that, we have more FaceTime with people, but at the same time, we are moving forward. And I think finding that new normal, but also realizing the importance of public health. When has public health ever been a priority? Public health is the #1 priority. And, we go through these types of situations to realize that, and also reflect on the entire team that makes up, the healthcare system. So just want to thank you for the opportunity. And again, thank and acknowledge our friends and partners for the excellent work that they've done. So thanks, Lowa.
Thank you. Thank you very much. And I do want to acknowledge as well, you are the CEO of a great organization that's doing good work. So to your leadership as well, thank you for all that you do. And I just want to go through, I'll give everyone approximately 30 seconds to do some closing remarks. And I will also thank all of you again for joining us. I will start with Dr. Sarin.
Well, thank you. Although COVID's still here, be aware, be careful. It's changed. We have different approaches now. We've learned a lot, and take care of yourself as we head into this time of hope. I've been wrong before, so stay tuned to what happens. Keep listening to Dina every Wednesday, and I'm very hopeful that we're in this new phase. But stay awake, stay aware. And thanks for having us and for the opportunity. Great work, Siksika. Great work, Ja. Nice to see you all.
Dr. Hu?
I think
Oh, he's freezing there. Okay, we're going to go to, I'll go to Charlene for closing.
Comment has been having there. Oh, I totally. Oh, shoot.
Maybe turn your camera off, Ja.
I'll go quick, Lowa, so we can jump back on. Thank you so much for having us. It's really been an awesome opportunity to share kind of what some of our strategies and our responses to the pandemic. And we just wish everyone a really safe summer. And thank you again for having us.
Thank you, Margaret.
Again, I think that I just want to thank you, Lowa, for providing this sort of platform for people to be able to listen and get different ideas. And, I think that's really helpful. Thank you to Chris and all the MOHs that have worked so hard over the last 2 years too. Without people like you, we wouldn't have got as successful as we were able to do. And God help us, I hope we never have to go through this again.
Thank you. And those that are with us, if I can ask you to stay when we go off air. JC?
Yeah, no, thank you guys for this awesome discussion. I loved, just talking about Siksika, Siksika Health. And, it's just really great to also get different perspectives. And just for the people listening, if you have any questions or you aren't unsure of anything about the pandemic, reach out to your local health, team and, ask these critical questions. This was a really great discussion, guys. Thank you so much.
Thank you, Dr. Hu. We'll try again.
Oh, sorry about that. Again, thanks everybody for everybody's work. I think understanding generosity of spirit are the key messages that have been shared today. I will say that when it comes to a lot of these events, you know, no time is safer than the summer. So, I mean, given their important, like, and it's now is the time. Every summer has been pretty good, and I'm hoping this summer will be, you know, at least in July and August, as good as the last two in terms of low case counts and low risk. So, do what you need to do. Yeah, and thank you all.
Thank you. I would like to take this time to thank our panelists for joining us for our discussion today. I'd also like to thank all of those that tuned in, and we will be continuing this conversation, and this broadcast actually will be rebroadcasted on other days. So thank you so much for joining, and thank you to the Windspeaker team and the Indigenous Services Canada staff.